I would like to take this opportunity to welcome all of you to this very important webinar. My name is Dr. Mary Cushman. I am a professor of medicine at the University of Vermont Larner College of Medicine and a hematologist directing the thrombosis and hemostasis program at the University of Vermont Medical Center. I am involved as an American Heart Association volunteer for our new Eastern States board. And I'm so pleased to have the presenters today to help us understand how to keep healthy during this COVID-19 pandemic. This is such an unusual time, and it's allowing us to find many different ways to come together to be social in this time where we are physically distancing from each other. And this is why I'm so thrilled to have all of you on the phone or on this Zoom call today. We are up to 88 participants, and we thank each and every one of you for joining in this important conversation. The reason we decided to hold this webinar was out of concern that people would have a lot of questions about how to keep healthy, and that we would reassure people that it's okay to seek care if you're having acute symptoms of cardiovascular related or other diseases. So with that, I would like to introduce our first speaker. I'm so thrilled to have Dr. Jan Carney on the call. So Dr. Carney is the Associate Dean for Public Health and Health Policy at the University of Vermont Larner College of Medicine. She is an amazingly accomplished woman. She is professor in the Department of Medicine at the Larner College of Medicine and UVM Medical Center. Prior to coming to the College of Medicine in this role in 2004, she served the state of Vermont as the Health Department's Deputy Commissioner and then Commissioner of Health from 1988 to 2003. So she has an amazing experience in applied public health. She is also a past recipient of the Vermont American Heart Association Crystal Heart Award given for volunteer service. So without further ado, I would like to introduce Dr. Carney, and note that you may enter questions in the Q&A box at the bottom of your screen. So you see the little icons with the bubbles that say Q&A. And if you enter your questions over the course of the presentations, we will field those questions at the end of both presentations, opening up a conversation with you. Unfortunately, we couldn't set it up so you could actually speak. So please enter your questions into the Q&A. And I also don't want you to be worried about writing down the names of web links that you're going to see, because the web links from the presentations will be sent out to all attendees by email after the webinar. So Dr. Carney, thank you so much for being here, and I'm going to turn it over to you now.
Thank you very much, Dr. Cushman. I'm delighted to be here. I'd like to talk for a few minutes about recognizing heart attack, stroke, and blood clots, and what you should do. Next slide, please. First of all, let's talk a little bit about COVID-19 and where we are. You've been hearing everything about social distancing, really physical distancing, but remaining socially connected, and it is working. It is, what does that look like? It's staying home if you're sick. And today I'd like to talk about some of those exceptions to this. We are concerned that there may be people staying home, but indeed they shouldn't be. And we're going to tell you a little bit about some of those conditions that should prompt a visit to the emergency department. Covering coughs and sneezes, and now people are advised to wear face coverings in public, washing your hands often. In the community, that's creating space between people, that physical separation, 6 feet apart. You know that we've all temporarily closed schools and public places. And in the environment, it means to clean frequently touched surfaces. For example, doorknobs, surfaces, countertops, refrigerator handles, and particularly your cell phones. And all these things are working, and they work to flatten the curve. And what that does is that has allowed our healthcare system to have adequate capacity to take care of people who are indeed very ill, and also it creates an environment in which we have far less illness in our community. So social and physical distancing is working and will be continuing for the short term. And now I'd like to talk about some of the conditions for which we should seek emergency care. Next slide, please. So let's first talk about heart attacks and the warning signs. And this link, as Dr. Cushman mentioned, we're giving you all the links and they'll be available for you so that you can go back and review this at your convenience. Let me just talk about some of the warning signs. First is chest discomfort. And most heart attacks have discomfort maybe in the middle of the chest. It may last more than a few minutes. It may come and go. It can feel like an uncomfortable pressure, a heaviness, a squeezing, a fullness, or just pain. Sometimes people have discomfort in other areas of their upper body, such as their arms, the back, their neck, their jaw, or sometimes their stomach. Sometimes people have shortness of breath, and this can happen with or without chest discomfort. And some people have things like sweating, nausea, or lightheadedness. Next slide. I want to just talk for a minute about heart attack symptoms in women, because although women often have that uncomfortable pressure, pain, squeezing, fullness in the center of their chest, they may be more likely than men to have some of these other symptoms. And I just like to review what those are, because we really want women to pay attention to their body and the symptoms that they could be feeling. Pain or discomfort in one or both arms, the back, neck, jaw, or even stomach. That cold sweat, sick to your stomach, or lightheadedness. And then again, remember that the most common symptom in women is still chest pain or discomfort, but women may be more likely to have those other symptoms. Next slide. Strokes. The easiest way to remember the symptoms of stroke are to remember the term FAST, F-A-S-T. So F is face drooping. So one side of the face might be drooping or is numb if you're that person experiencing it, or if you're looking at someone else, ask that person to smile and see if that smile looks uneven. A is arm weakness. Is one arm weak or numb? And if you're with someone who's experiencing the symptoms, you can ask them to raise an arm. And is one of them, if they try to raise both arms, does one droop downward? Speech. The person's speech may be not normal for them. It may be slurred. The person may be having a hard time speaking, or you're having a hard time understanding them. You can ask someone to repeat something that you're saying to get a sense of that. And then T is, it is time, if people are experiencing these symptoms, to call 911. This is a true medical emergency. Next slide. The last condition I want to talk about is venous thromboembolism, or VTE. VTE includes deep vein thrombosis, DVT. This is a blood clot that forms in a deep vein. It's usually in the lower leg and thigh. Now, when this blood clot forms, it can block the blood flow and can cause symptoms of pain or tenderness in your thigh or calf, swelling of your leg. Sometimes your skin might feel warm to the touch, and you might even get red streaks or reddish discoloration in the area of this. Particularly blood clots in the thigh can break off and travel to the lung. And this is called pulmonary embolus. This is very, very serious and can cause symptoms such as severe chest pain or shortness of breath, sometimes lightheadedness or passing out. Next slide. Life Simple 7. What is my life check? This is this web link. I would encourage everyone who's watching to go on and do my life check. This is as a result of research studies and Dr. Mary Cushman. If you squint, you can see her name on this slide, has been part of this research and other research that shows that these 7 risk factors are related to whether or not people might get a stroke, and also studies related to cognitive impairment. So what are these risk factors and why are they important? managing blood pressure, controlling cholesterol, reducing blood sugar, getting active, eating better, losing weight, and stopping smoking are all risk factors that, if they are managed well, they can help people have their optimal cardiovascular health. And if you can go onto that web link and you can check those for yourself, and we're going to hear more about some of these during the rest of the webinar. Next slide, please. So for those symptoms, those conditions that I talked about, and those serious symptoms that I talked about, heart attack, symptoms of heart attack, stroke, pulmonary embolus, these are potentially life-threatening, very serious conditions. And if you are experiencing any serious health symptom, don't wait to get help. Call 911. So even within COVID-19, there are conditions that you really do need medical attention right away. Next slide. Next slide. On the end of that Life's Simple 7, I just want to mention one risk factor, because at every opportunity, I always remind people, if you are still smoking, please try and make a quit attempt. This is a great time to improve your health, and there are resources available for you in Vermont. 802 Quits is a wonderful resource. It's free. You can contact them by phone. You can have in person when we're not social distancing, and you can do this online. You can get free quit medications. People can talk to you. You can get coaches 24/7 and email and text support. Any way that you want help quitting, you can get it through 802 Quits. And I would also mention that if you are vaping, I would also recommend you quit. And if you're not vaping, please don't start, because both of these conditions seriously impact your risk for having more serious outcomes if you were to contract COVID-19. And these are absolutely essential risk factors in the development of the cardiovascular conditions that I just talked about. So need help to quit smoking, 802 Quits. Next slide. And these are just my suggested resources. The Vermont Department of Health has great resources on everything we've talked about. They are the go-to place for up-to-date information in Vermont on COVID-19. Likewise, the Centers for Disease Control and Prevention has high-quality, evidence-based resources that are easily understandable. And the American Heart Association, we've given you the links to all of these. For help quitting smoking, there's 802 Quits, and the CDC also has a quit smoking line there and resources for you. Back to you, Dr. Cushman.
Thank you so much, Dr. Carney. That was really informative. I would like to remind people, as questions arise in your mind during the presentation, please click on the Q&A box at the bottom of the screen, and you can pose your question, and those will be responded to for discussion at the end of the next talk. So, and again, thank you for those who joined during Dr. Carney's talk. We now have 106 participants on the line. We're thankful for each and every one of you being there to hear what we have to say. So next, I'd like to introduce Dr. Sherrie Khadanga, and the title of her talk is shown on the slide. She'll be talking about keeping healthy while you're staying at home. Dr. Khadanga is a cardiologist and assistant professor of medicine here at the Larner College of Medicine at the University of Vermont. She serves as the assistant director of the cardiac rehabilitation program at the University of Vermont Medical Center. She also chairs the University of Vermont Cardiovascular Research Institute's Early Career Advisory Committee. Her research focuses on heart disease in women, and specifically cardiac rehabilitation, and ways to improve participation and outcomes of cardiac rehabilitation in women. So with that, I will turn it over to Dr. Khadanga, and thank you for being here.
Thank you, Dr. Cushman, for that kind introduction. Next slide. So for those of you who are unaware, lack of exercise is actually an independent risk factor for the development and progression of coronary heart disease. As many as 250,000 deaths per year in the United States are actually attributable to this lack of physical activity. And one of the things that I hope you get out of this is kind of recognize what are the benefits of exercise. And there's so many that one can think of when you think about exercise allows you to lose weight. It also lowers your blood pressure. It can lower your cholesterol, both your LDL as well as your total cholesterol. It also allows for your immunity to become better, and your immune system is actually one of the ways that we fight an infection. And exercise is a great way to reduce stress and anxiety. Next slide. So oftentimes my patients will ask me, you know, Dr. Khadanga, how much exercise should I be getting and what's really recommended? And per the guidelines from the American Heart Association, as well as the American College of Cardiology, what we recommend is that everyone do at 150 minutes of what's called moderate intensity physical activity, or 75 minutes of vigorous high intensity physical activity. And so in your mind, you might be thinking, well, what really kind of constitutes as moderate intensity versus high intensity? And so when I think of moderate intensity, what you're sort of looking at is brisk walking, jogging, if you're going for a leisurely swim, versus the higher intensity types of activity is any type of competitive sports, whether that be tennis or basketball, cross-country skiing, which is often a favorite for us Vermonters, and doing things such as running and cycling, which is an inexpensive way to stay active. And unfortunately, despite this evidence of knowing the benefits of exercise, only 19% of women and 26% of men actually follow these recommended guidelines. Next slide. So for those of you who are kind of thinking, what type of activity can I do during this time of COVID? You know, I know a lot of gyms are closed. Even in my program where I work with the cardiac rehab, you know, different sources are now becoming unavailable for patients in the time being. And so there's still quite a lot of things you can do to stay active when you're at home. And so an easy way that I've been telling my patients is with the indoor activities, you know, if you have a multiple level home that has stairs, you can go up and down those stairs, put on some music, take some laps around the house, and you want to try to get in 10 to 15 minutes, maybe 2 to 3 times a day. And that's a great way to stay active if you're inside or it's a rainy day. Some simple things, just picking a song, dancing around the kitchen, ways to stay active. A really efficient way, if your joints are able to handle it for my older patients, is doing just a simple jump roping. That's actually a great cardiac exercise that you can do at home. And then now with so many readily sources available with YouTube and, you know, with cable, Xfinity on demand, there's many multiple types of exercise videos that you can do online. And so that's sort of an easy way that you can do for activity that's indoors. If you're getting a little bit stir crazy and trying to want to do something that's outside, doing simple things such as a walk or a jog around the park, your neighborhood is completely fine. But what you really do still want to strive for is maintaining that recommended 6-foot physical distance between you and another individual. And so whether that be jogging, going for a bike ride, doing some things around the home, such as gardening or lawn work, you know, spring is right around the corner. And so that's a great way to continue to stay active. Next slide. So for older adults in particular, there's really 4 main components that I really stress, especially for the patients that I see in our cardiac rehab program. And so one of that being endurance. And what that means is you want to do some type of physical activity that increases your breathing and your heart rate. And so what that feels is exercise where it's a little bit challenging for you to have a full conversation and so forth. Another thing that's really important to focus on is working on your balance, because we know that if you do exercises that help with your balance, then that can really be a key way to prevent falls. And so a simple technique that I tell my patients is doing what's called the heel to toe walk. So kind of like you're walking on a balance rope, is a tightrope is a great way to maintain that type of skill. And then also you can do the flamingo standing on one foot, And if you need a chair initially to help you feel secure, that's fine. Make it to where you feel steady, and then over time you'll get that practice. So those are easy ways that you can keep your balance while staying at home. In addition, strength training is really important because you want to make sure that you're able to increase that muscle tone. And so if you happen to have some dumbbells laying around the house, light weights, that's completely fine to use. You know, things that are around the home that are 1 to 2 pounds. If you're just starting using some resistance training, that's fine to use as well. And then another component that's important is flexibility. So make sure that you stretch, that you try to stay limber. And that's a key component for older adults when they're trying to look at ways to exercise. During this time of COVID, I think that mental health is really important. And I know that many of us, myself included, are having thoughts where our stress levels or anxiety may be high. And so really what you want to aim to do is to try to minimize as best you can and manage your stress and anxiety. And by minimizing those things, that's really important because it'll allow you to have proper sleep. And so some useful sources that you can practice, whether you enjoy yoga or meditation, or maybe this is the opportunity to get to those things that you always wanted to try. There's actually some really good websites available that kind of help you go through these techniques, Headspace, as well as Talkspace. And later on, we'll provide you those links after the webinar for those who are interested. One thing that someone had suggested to me in the past, and I kind of found it useful, was creating a space in your home that's sort of technology free. And what that allows you to do is it sort of gets you to unwind and relax away from distractions and really just focus on yourself and kind of get through your thoughts and so forth. And so that's something to consider to kind of help with your overall wellness. And then with these uncertain times, it's hard to kind of feel motivated to maybe do something, to do your activity, or sometimes you get stuck in a rut. And so you really want to, as best you can, try to stick to a routine. And so try to get up and go to bed at the same time, because what that will allow you to do is sort of maintain your circadian rhythm. So meaning like your body clock, and that sort of is what will help regulate overall your appetite and your mind. And so it's really important to kind of stick with some sort of routine in your daily life. Oftentimes when we find that we're working from home or limited in kind of places that we can go out and so forth, you know, you tend to snack more, and that's really challenging, I think, for all of us. And what's important is that when you're doing your shopping and making your plan for the week, that you sort of come up with a daily meal plan. And that allows you and your family members or your loved ones to kind of know what's to be expected. And that allows you to, again, follow this routine of having some continuity and constants. So, you know, have your 3 meals a day, you can have some snacks, but sort of planning as to exactly what you would do if you were going to work or so forth. And then, you know, meals are an opportunity that you can connect. And so I have been doing some meals where I will sit down with my parents and we'll use FaceTime or Zoom to kind of connect. And so it's a really an opportunity to kind of still maintain that closeness and that social connection that I think we're all kind of longing for. When you look at your plate, I think what's really important is to think in your mind, am I eating a rainbow? And so you really want to make sure that you load up on fruits, vegetables, lean proteins, whether that's frozen vegetables or fruits versus fresh, that's fine, but really kind of stick to making sure that you have a colorful plate. And some tips, you know, before any type of meal prep, just make sure that you wash your hands. Even for groceries, when you do get groceries, whether you're going out to pick them up yourself or you're getting a delivery, you do want to try to wipe it down, whether it's with Clorox wipes. I know that sometimes it's hard to find those type of wipes that are alcohol and so forth. And so even just soap and water to wipe it down is completely appropriate as well. And then every now and then you just want to treat yourself, and having the occasional food delivery is totally fine. But again, with any containers and so forth, it's good just to wipe it down. In regards to medical care, you know, I think during this time, a lot of people are finding that appointments might be pushed or they're not quite sure what to do. And so at least within our institution at UVM, I know various departments and divisions have really strived to do what's called telemedicine. And whether that be having a Zoom conference or a video conference to allow for patients and providers to check in versus having follow-up phone calls. You know, if your provider, whether it's your primary care doctor or one of the subspecialists you see, is offering that to you, then I would encourage you to do that. You know, there's always these moments where the provider may make the decision to push an appointment out or may ask you to actually come in clinic later in May or so forth. And so that's fine to follow with the advice of what your physician says. But if you're given this opportunity to have a follow-up, a phone call or a video conference, then I would encourage all of you to keep with that. And as Dr. Carney had said, one of the things we really want to stress is if in doubt, you feel that you're having any alerting symptoms, you don't feel right, there's something that has been a new change for you and you're concerned about, please seek help and call a doctor. And if it's an emergency, 911 is always available. You know, it's more dangerous for you to kind of stay with these symptoms at home and not seek help in the event that you're worried about COVID and so forth. And so I would really say to anyone who is concerned, trust your body. And if you have anything that's new or developing, please seek a provider. Continue to wash your hands regularly. And if you do go outside, I highly encourage that you wear a cloth mask. And that protects really not only yourself, but the individuals around you. And these are just some sites that I kind of found helpful to allow people, if they want to know some healthy tips as to some recipes or some virtual exercise classes and on-demand yoga and meditation. These are some great resources that you can go to. And with that, I'll hand it back to Dr. Cushman.
Thank you so much, Dr. Khadanga. That was just fantastic. So I'd like to start the Q&A session, and we will stay on as long as we can until we get everyone's questions answered up through as late as 1 o'clock Eastern time. So if you have questions that you have not yet entered into the Q&A box, please feel free to do so. I'd like to start with Dr. Carney. There's a question about reinfection with COVID-19. A news report out of South Korea about patients who recovered from coronavirus and then apparently were reinfected. And what do you know about that? And would people with heart disease, with a history of heart disease or stroke in the past be more susceptible to reinfection?
Dr. Cushman, I don't think we know everything about this yet. I don't think we understand fully about how people are spreading the disease when they don't have any symptoms and when they're recovering, what their profile of immunity looks like. That's under intense study. But let me just tell you how I think about it in the meantime. I think the steps that we're all taking now with our social distancing, staying at home whenever we can, and being careful, wearing those masks in public, the things we're doing to protect everyone from that. And as we learn more, I think there's guidance from CDC about how long after people have been sick, when can they go back to resume their activities. And in the interim, I think we're just being cautious. And I think that we will need to see more data, both from the United States as well as what we're learning from China and Singapore and other countries. But my short answer is, I don't think we fully understand immunity and how long it lasts for COVID-19.
Yeah, and I can add to that. There are various kinds of science reports coming out, and they come very quickly, and the science literature can be quite confusing to follow. And I think the quality of everything that we see is not necessarily high. So in general, I think we have to trust our public health officials tell us what the best thing to do is, and to trust our own physicians and providers help us keep healthy in these regards. And follow along with what is being recommended. And then, of course, if you have doubts about what your public health officials are saying, then referring to your physician or your primary care provider is the way to go. I think, there can be disagreements about different things that we hear about. And so always checking with your health provider is the way to go. I have another question for you, Dr. Carney. Are there any issues with fast walking or slow jogging outdoors while wearing a homemade cloth mask? Wondering if there's air restriction or could be problems with health from doing exercise while wearing a mask.
Let's just talk for a minute about what's the purpose of those masks. And those have been recently recommended for everyone. And we're calling them face coverings to distinguish them from medical masks, because we know that people in healthcare settings, all health professionals, are wearing different kinds of masks to protect themselves when they're taking care of ill patients. So the cloth mask, what they will do is, if you're wearing a cloth mask in a place where you can't really stay 6 feet away from people, and you cough or sneeze, you're going to cough or sneeze into that mask, and you're actually going to protect all the people around you. So if you think about a grocery store where there might be several people in an aisle and you can't stay far apart, if everybody is wearing those, we all protect each other. So that's a great thing. So I would encourage people to follow that recommendation. Now, when you're outside, I think you have some judgment. If you're 30 feet away from people and you're riding your bike or you're walking and there's no one in sight, you may or may not even have to wear that cloth mask. But if you do, I think test it out, and some common sense here. If you can hold that mask up to the light and you can see through it, it's probably a little bit more porous. If you're having any trouble breathing when you are wearing your mask, that would make sense that mask might be too restrictive for you. So with exercising, I think we have to use a little judgment and common sense. And if we're outside and there's no one around, you may not even need to wear that cloth mask.
Great, thanks for that. So there's a question for me asking to expand on Dr. Khadanga's exercise recommendations by talking about reducing risk for blood clots through exercise and who's most at risk for developing blood clots while they're staying safe at home. So remember, blood clots, the deep vein thrombosis and pulmonary embolism that Dr. Carney talked about is a very important cardiovascular disease. It's the third leading cardiovascular disease after heart attack and stroke. And keeping your blood flowing or keeping yourself moving is very important to preventing the blood from clotting in the veins of your legs. So blood doesn't like to sit still. So when you are relatively sedentary, like if you're staying in the house and not moving around much, the blood can pool in the veins and that causes it to congeal or clot. People with other risk factors are most at risk of this. And these include people with cancer or obesity or immobilization, like they have a plaster cast on their leg, or people who've recently been in the hospital. So in hospital settings, there's a lot of immobilization that raises the risk of clots. So keeping moving as much as you can is a good idea. And the risk is highest for this in older people. I saw a patient recently who was in her 90s and had a couple of weeks of quarantine and ended up getting a blood clot based upon not moving around much. So all of the things that Dr. Khadanga discussed about exercise and movement is also effective at reducing the risk of these blood clots forming, which is more like an acute effect of the lack of activity. So I have a question for Dr. Khadanga. Is it safer to have blood work done at a hospital lab or at the doctor's appointment, at the doctor's office by appointment if you need blood work in terms of the risk of catching a virus? Are you going to catch a virus by going to the lab, for example?
Yeah, no, that's a great question. Overall, what we sort of are recommending our patients in the cardiology clinic who need to have lab work done is for them to go to an outpatient clinic. It's just minimal exposure compared to going to the hospital per se. And so
as opposed to there's no guarantees in life. And so I couldn't say that by getting your blood work done at your primary care's office or one of the subspecialty clinics, that is a truly safe environment, but the risk is a little bit lower in that type of setting just compared to going to the hospital and the amount of people that are coming through. So it's really more of a numbers game.
And so related to that, how often should we have our cholesterol checked? Would you recommend people go get checks at this time or kind of wait until later to do that? And in general, how often should adults be having their cholesterol checked?
Yeah, so that's a great question. So it really sort of just depends in the sense of your medication. So if someone's just starting a medication to lower cholesterol or so forth, oftentimes what we say is to have repeat blood work in sort of the 6 to 8 weeks so we can see the effect of the medication. So for example, if you were recently prescribed Lipitor, that's a medicine that works pretty well and pretty quickly, that we can sort of see the effects on the cholesterol panel. And oftentimes, in addition to that, they may get some basic work of looking at your liver function tests and so forth. And so if there's any time a change in therapy for medication, then shortly after, again, sort of 4 to 6 weeks, some of the physicians may opt to kind of do a repeat lipid panel. For my patients who have sort of been doing fine, have a standard dose of their medication, and I check it at least once a year, either when they come to see me or working with their primary care provider during their annual visit to get that lab work done. For right now, if people aren't having any issues with their medications, then I would recommend that they hold off on getting the labs and just wait sort of another month or so once things slowly start to open back up. And I think that's just sort of minimizing, again, your exposure. You know, Governor Scott has still issued the stay at home until May 15th, and then afterwards has outlined a plan as to how we'll move forward. And so this is something that will take time, but something like a lipid panel is not really an urgent lab work that needs to be done. And so that you can wait to have it.
Back to Dr. Carney. So we have a question about being of concern that people with symptoms that are unrelated to infection, like chest pain, are not having these evaluated. Can you discuss how to proceed if you have health issues or symptoms not related to the virus?
Yeah, I think that's one of our. I think that's what we're trying to emphasize today. That the message and people are getting the message. If you have symptoms that are consistent with COVID-19, you might have a cough or shortness of breath and fever, then you're calling your medical office. You're not just going to the emergency department. And I think what we're trying to emphasize is both there's emergency conditions. If you're having a heart attack or a stroke, you clearly need emergency care. If you have ongoing chronic conditions, there are often times where you can get ongoing visits through telehealth right now, and you need to call about your symptoms. And if you have someone that you're already seeing, call their office to check in. Definitely get those checked out and don't ignore them.
Great, thanks. Yeah, that's really one of the main messages that I hope everyone who's attending this webinar will take with them and share with their family and friends. And I've been posting a few things on Twitter during the talk. My Twitter is @Mary Cushman MD. So these messages are really important to share with your networks. And so please do amplify this message that we're trying to share with you out of this webinar today to all your family and friends, to call 911 if you're having chest pain or stroke symptoms. Remember FAST, face, arm, speech, time is brain. And if you have unexplained leg swelling or pain, trouble with your breathing, and you're not sure if you should call 911, please call your health provider for advice on what to do. And I cannot emphasize enough, do not be afraid to come to the hospital. All hospitals have procedures in place to separate patients of having COVID-19 from other patients. Those patients who have suspected infection are placed in different parts of the hospital than other patients and different parts of the emergency department than other patients. And so you should not feel afraid that you will get infected by coming to the hospital. So if you need hospital care, you need it, and please trust the medical system to take good care of you. So I think this is a question for Dr. Khadanga, or maybe either of you. I'm wondering if there's a way to measure how strong one's immune system is. And I think maybe it keys more on, you know, if you, are there immune factors that predispose people to getting infected? And maybe I could try this one. You know, I think certain people have diseases like some kinds of cancer and are on medications that suppress the immune system, like chemotherapy, or medication for autoimmune diseases like systemic lupus or rheumatoid arthritis, or even psoriasis. And those treatments may impair the immune function or your ability to fight off infections. There really isn't a way to measure that in general terms. There's not a blood test you can get to measure your immune function, but I will say that keeping active with physical activity and a healthy diet is thought to strengthen the immune response and immune system. So all of the biologies that make up a part of how the human body functions are all interrelated. And these 7 factors, the Life Simple 7 that we talked about, especially the behavior components of Life Simple 7, are all known to be associated with, if you will, a stronger immune system. And so really keeping physically fit and active is a good bet in that regard.
Yeah, I think I absolutely agree. And a couple of things Dr. Kananga talked about, that healthy diet and being physically active throughout this time is really, really important. A couple of things we haven't mentioned yet, and just general advice I'm giving people is that stick with your routine. Stay on a regular routine. And that's particularly important for sleep. And to get enough sleep and stay on a regular sleep routine. If you're used to getting up at 7 in the morning, continue to get up at 7 and don't stay up later than usual. That's important in terms of people getting too little sleep may be more likely to be overweight. And then that gives you a risk factor. I also think that getting good sleep and regular exercise is important to keep your stress down. And we've talked a little bit about stress and some tips to keep your stress level down. I think that's also very important in making sure that we're staying on an even keel, an even mood. So those would be a couple of things I might add. And maybe just one more, that is, we're in a period of time right now that we're going to be in for a little bit longer for about this physical distancing. And that means that we have to work a little harder to stay socially connected. And we're all social beings. So I think that we need to keep doing that any way we can, whether that's phone, Twitter, texting, Zoom, Skype. There's some more than that, I know. There's Instagram. Oh, yeah. So however we can and whatever we like to do to stay connected to family and friends, because we're going to get through this. We're doing great. We're doing great right here in Vermont, and we're going to get through this.
And, you know, I say, Jan, I think we all do our little part to help our colleagues, our friends, our family, our coworkers. And one thing I've been doing most every night on my Twitter is posting a picture of the sunset over the Adirondack Mountains. So we are fortunate in Vermont to live in a beautiful place. And I am fortunate to live in a place where I can see the Adirondack mountain range from my house. And I've been posting the sunset every night. And I get feedback from people all around the world saying, oh, I really enjoy seeing your picture of the sunset every night. It's just, I feel like I'm able to bring some beauty into people's lives, something non-controversial that can make people feel good at the end of a day or the beginning of the day if they live on the other side of the world and they're following my Twitter feed. So I think we all can do something to help others, however big or small, you know, that it is. And that is fulfilling for us to to do. It's such a difficult time. And I think the psychological impact of being able to help others is something that can be very beneficial for anyone. And, you know, maybe Sherrie Khadanga, Dr. Kananga, you could comment on kind of the, you know, depressive symptoms and how all of this kind of feeds into the potential for people to have depressive symptoms or mood swings, and what might be done to try to mitigate that.
Yeah, I think part of the concern I think that any provider has, regardless of what type of medicine you practice, is just sort of, you know, how this virus has really taken a toll on everyone's mental health. And I think that it can, you know, I really appreciate when Jan was saying, you know, we're trying to emphasize physical distancing, not necessarily social distancing. And so, you know, a slight silver lining in this kind of pandemic has been an opportunity for people to connect and reestablish friendships or relationships. And really what it allows you to do is have this sort of social connection where even though you physically, at least maintaining this contact through a phone call or through video conferencing, you allow to kind of have that connection. And, you know, one aspect is to really try to stay engaged and make sure that you can talk to someone. You know, there's different support systems out there, even for people who need just some counseling, and to have sort of the safe outside space that's provided as well. The state has done a really good job of giving us resources for that. But one of the things that, you know, for me personally, I find really helpful to kind of help clear my head is really the importance of physical activity and sticking to this routine. And I think that's what Dr. Carney and I really kind of want to emphasize is, you know, when you go out for a run or you do some type of activity, it really does have a huge effect on your mental health because you're releasing these endorphins by increasing your heart rate. You know, it's sending these chemicals to your brain, and then it kind of senses like, oh, hey, my mood has gotten better. It really does relieve your stress and anxiety because physiologically it will lower your blood pressure and so forth, you know, during the cool down. And so that's sort of one of those ways that you can really stay active and help with your mental frame of mind. And then doing things that, you know, yoga, meditation, that's become very popular for people, allowing them to decompress. And really, sometimes people worry and have this fear of, you know, I'm not feeling quite right or I need help. And what we really want to encourage everyone is, you know, everyone is still around to provide you the medical care that you need. I don't want anyone to feel worried or afraid to go to the hospital if there are symptoms or to go to clinic if they need to see a provider. I know I myself have seen some patients coming into clinic because I was concerned about them for having another episode or so forth. So we're all here to work with you, and all of the precautions are being made, especially at UVM with our mask policy. You know, every provider, every person who comes in, whether they a patient or a staff worker, all of us are wearing masks in order to minimize this exposure. And so I hope that people can rest assured that if you need to have the medical care, that we can provide that in a safe manner.
Great, thank you so much. So this question maybe would be good for Dr. Carney. We have a large population of people in Vermont and in Northeast in general who go south for the winter. And if they are planning to return at this time of the year and stop and stay overnight with relatives along the way, would you recommend avoiding this or doing this? And then when they get back home to the north, should they quarantine for some period of time? Should they avoid moving in with family members? If they're living with family members upon the return, what should be restrictions in place for that sort of situation? How can we travel safely? I know some snowbirds who are still down in Florida. Mm-hmm. Can they come home, and how should they do that?
If, you know, these become very practical questions. And so I guess let's think about everybody's situation is a little bit different. So first question is, if you're someplace and you're sheltering at home, you're staying at home, you're being safe, do you have to travel yet, or can you wait a little bit? And at this point in time, waiting, if that's an option, might be a good thing until things have, some of the states have shown substantial declines. And if you're traveling, I think that, you know, that we're recommending people say 6 feet apart from others, that social distancing, that physical distancing. So a lot of hotels and places to stay are closed in many states. So you have to consider that and you have to plan ahead. And I would say that the fewer places that you stay with the fewer people is better. And again, we have to be practical about it. When you get home, I think they're recommending that you might sort of self-quarantine yourself. Now, if you're living with your family, what exactly does that mean? And if you're perfectly healthy and you feel really well, what you're saying is that you're really not going to go out to public places for a couple of weeks until sure you're past the incubation period. If you're living in a house where you can stay separate from other people, that's the best case scenario. But again, I think that we have to look at sort of from the beginning, do we have to travel now? Can we postpone that? And if we do travel, let's do it as safely as possible. And when we get home, let's make sure that we haven't been exposed and we're not going to get sick. So protect ourselves and our family members and the public.
Yeah, thanks, Jan. And I think the other resource perhaps for people is to refer to their state health department websites.
Yep.
We have people from all across the country on this call. And you know, if you go to your state health department, they might have a Q&A about that specific topic that relates to your state, because the patterns of this disease are differing in different states across the country as well. Okay, Dr. Khadanga, how bad is it for your heart health to drink half and half in your coffee if you have 2 or 3 cups a day?
So I'm a purist where I would say that if you can cut that out, that would be better. And so having an alternative would be just switching to like 1% milk or skim milk. It's all about quantity and having things in moderation. If that's sort of your one guilty pleasure that you really enjoy, then that's okay. But that to me is a simple way that you can reduce some excess calories and fat in your diet by switching to an alternative.
Yeah, I have to say I'm very proud. I switched to black coffee in the past year. I had a trip to Australia last summer and black coffee was the way to go. And I love it so much because I can really taste the coffee now. I don't put anything in it and it's just great. Okay, so maybe Dr. Carney for this one, what is the time frame that you think would be ideal for reintegration to getting back to normal?
I think that right now in Vermont, we're looking at the stay at home until May 15th. We're seeing some of the workers that are working outside, apart from each other, doing some work starting this week. I think that's a great thing. It also makes sense to me. They're not working in confined spaces with other people. They can stay physically distanced and practice those other recommendations, such as wearing cloth face covering. I think that we're going to have to wait and see. And I think we just all need to be patient. Everyone in Vermont and every other state, and as Dr. Cushman said, the experience in other states can be very different. It can depend on how much community spread they have, how much the population density is, whether or not they have been successful at social distancing and flattening the curve. And I think that every state is looking at what are the new cases that they're seeing, how much illness in the community, and making some common sense judgment about doing it at the right time and not waiting too long. People are eager to get back to work in their activities and get their hair cut and other kinds of things, but not doing it too soon such that we might see just a rebound, increased infection in the community. So I can't be any more exact than that right now.
Yeah, I think just like many other questions, relying on your local and state authorities on this advice is really the way to go. Okay, so for either of you, or maybe even myself, what are we seeing about the longer term impact of this infection on the heart and lung symptoms? Are there any symptoms that people who've had the virus should look out for? I could start with this.
Yeah.
I would say this is a new disease.
Mm-hmm.
And we really don't know what to expect. So in the near term, say after hospital discharge or after recovery, it may be that the most prominent vascular disease that might occur would be deep vein thrombosis or pulmonary embolism or VTE, as we were talking about before. And that would be likely the most common one, but inflammatory triggers can also trigger heart attacks and strokes. So just being aware in the near term about that. From the point of view of the long term, we really have no idea because it's a totally different disease. And the biological profile of what's going on in this disease seems to be unique compared to other infections or other acute illnesses. So in our own research, we will be working with others around the country to get grant funding to look at the long-term impact. You know, what is the effect on brain health and cognition and functional status and cardiac function and structure? Are people having, you know, heart attacks more often, for example, after they've had this? So that kind of research is going to require time to go by and funding to be put in place. We're very fortunate that the National Institutes of Health is making rapid decisions about funding research grants. And the American Heart Association is also doing this. The American Heart Association is putting in $2.5 million into COVID-related research urgently. And the reason the American Heart Association can do that is because of the generosity of donors. And so I think some of you may be receiving messages about making donations to the American Heart Association, and the money that is raised through this goes into research. And so this is going to be really important because we just really don't know the answer to these questions at this point, and we need research to get the answers. So with that, we're nearing the last couple of minutes. So I would ask Jan and Sherrie, maybe Jan first and then Sherrie, if you have any final thoughts, 30-second thoughts that you want to convey.
I think that we're going to get through this. I know we're going to get through this, and I have a high level of confidence in Vermont. I think that what we'd like people to think about is how we can, in the interim, improve our health over where it is. And you've heard a lot about the kinds of healthy habits that you can do to reduce your risk. And if we can all just do a little bit, when we're back outside, we can be even healthier than we were before.
Great. Dr. Kananga?
Yeah, I'd say that I would, encourage people to take time and kind of use this as an opportunity to really focus on themselves, and with this extra time working from home and so forth, to try things that are new. If you never had that time in your schedule to exercise because of work, really try to now factor that in. Take moments for yourself where you can stay active, whether that's inside or outside. Try new recipes, cook for yourself, be creative. So there's different opportunities that we might not have thought of as to ways to kind of occupy our time. And I agree with Dr. Carney that, at the end of this, we'll get through it. And really this could be an opportunity for us to improve our overall health. And so to try to make the most of it.
Great. I couldn't have said it any better than either of you. And I would like to just end with the plea to remember, if you're sick, call for help. Chest pain, difficulty breathing, stroke symptoms, face, arm, speech, time is brain, the FAST acronym, please call 911 and get the help that you need. And with that, it's at the top of the hour. I would like to thank all of the American Heart Association staff for helping us get this webinar together, especially Rosie Kelly and Nancy Luke, who is here in Vermont. And I would like to offer my deep thanks to Drs. Khadanga and Carney for putting together the slides for today and sharing your knowledge and expertise with us. And I hope all of you have a safe day and maybe a better day than you would have had if you weren't on this webinar. So thank you so much. And we will be emailing out links to resources, websites and such that we covered during the webinar. So thank you so much for attending, and have a great afternoon and evening.